Let me ask you something very simple. When was the last time you got out of a chair without thinking about it? When was the last time you walked down a flight of stairs and didn't once grip the railing for fear of what your knees might do? If you're watching this video right now, there's a good chance that those small, quiet moments, the ones most people take completely for granted, have started to feel a little less certain for you. And I want you to know something important before we go any further. You are not imagining it. You are not being dramatic. And this is absolutely not just a normal part of getting older that you have to accept and move on from. I have spent years working with patients over the age of 60, and I can tell you that the single biggest mistake I see over and over again is this: people wait too long. They feel something off in their knees, their hips, their shoulders, their ankles. They tell themselves it will pass. They take an ibuprofen, they rest for a few days, and when the pain quiets down, even slightly, they convince themselves everything is fine. But here's the truth that most people are never told clearly enough. Joint damage does not announce itself loudly. It whispers, and by the time it starts to shout, the window for the most effective intervention has often already passed. Today, I want to walk you through 5 signs, 5 specific, concrete warning signs that your joints are getting worse right now. Even if you feel like the pain is manageable, even if you are still getting around okay, even if your last doctor's visit came back with nothing alarming. These are the signs that I look for in my patients, the ones that tell me we need to act now rather than wait. And I want you to pay very close attention because some of these are going to surprise you. Before we get into the list, I want to set one expectation clearly. This video is meant to be educational. I'm not here to frighten you, and nothing I share today is a substitute for an evaluation by your own physician. But what I am here to do is give you information, real, useful, actionable information that will help you have a more informed conversation with your doctor, notice things you might have been dismissing, and understand what is actually happening inside your body. Knowledge is not anxiety. Knowledge is power. So let's get into it. The first sign is morning stiffness that lasts longer than it used to. Almost everyone over the age of 60 experiences some degree of morning stiffness. You wake up, your body feels a little rigid, a little slow to get going. You shuffle to the bathroom, you stretch a bit, and within 10 or 15 minutes, you're moving reasonably well. That is normal. That is the natural consequence of lying still for 7 or 8 hours and your synovial fluid, that is the natural lubricant inside your joints, becoming less evenly distributed during sleep. But here is where I need you to pay attention. If your morning stiffness is lasting more than 30 minutes consistently, that is no longer in the range of normal morning grogginess. That is a clinical signal. In the world of rheumatology and orthopedics, we actually use the duration of morning stiffness as a diagnostic marker. Morning stiffness that resolves in under 30 minutes is more consistent with osteoarthritis, the wear and tear type of joint disease. Morning stiffness that lasts longer than 30 to 45 minutes and is accompanied by joint swelling can point to inflammatory arthritis, which is a different category entirely and requires a completely different treatment approach. Now I want you to think back, not just to this morning, but to 6 months ago, a year ago. How long did it take you to get moving comfortably in the morning back then? Has that window been slowly expanding? Have you found yourself needing more time before you feel ready to go down the stairs, before your hands feel like they can grip things properly, before your hips feel stable enough to walk without that tentative, careful quality? If the answer is yes, and especially if that window has been creeping longer over recent months, your joints are telling you something. They are telling you that the inflammation inside them is not fully resolving overnight the way it should. What tends to happen is this: people adapt. They start waking up a little earlier so they have more time to loosen up before the day begins. They stop making breakfast in the morning because standing at the kitchen counter for 15 minutes feels like too much. They find clever workarounds, sitting on the edge of the bed longer, using a grab bar, asking a partner to hand them things. These adaptations feel like solutions, but they are actually masking a progression. And masking is the enemy of early intervention. If your morning stiffness is consistently lasting over 30 minutes, I want you to note the exact duration for 1 full week. Write it down each morning. Then take that log to your doctor. That information, the duration, the affected joints, whether it improves with movement or worsens, is genuinely useful clinical data that can significantly accelerate the right diagnosis and treatment. The second sign is a change in the quality of pain you experience. This one requires you to be a careful observer of your own body, and most of us have never been taught to do that particularly well. We tend to report pain in simple terms. It hurts. It hurts a lot. It hurts less today. But the character of pain, the texture of it, if you will, is actually one of the most informative things we have in assessing joint health. Let me describe what I mean. There is a kind of joint pain that is associated with activity. You walk 3 blocks and your knee starts to ache. You climb a flight of stairs and your hip complains. You stop, you rest, the pain recedes. This is what we call mechanical pain. And while it absolutely needs attention, it tends to indicate joint damage that is responding primarily to load, to the pressure and friction of movement. It is meaningful, but it is often manageable with the right interventions. Then there is a different kind of pain, pain that is present at rest, pain that wakes you up at night. Pain that you feel not just when you are moving, but when you are sitting still, when you are lying in bed, when you have done nothing at all to aggravate it. This shift from pain that is triggered by movement to pain that exists independent of movement is one of the most significant changes I monitor in patients. It typically signals that the inflammatory process inside the joint has become more active, more sustained, and less responsive to simple rest. There is also a third quality I want you to watch for, and that is the presence of a deep, boring, aching quality to the pain, different from the sharp, immediate pain of an acute injury. A deep ache that settles into the bone, that feels like it is coming from somewhere inside the joint rather than around it. This type of pain, particularly when it is present at night or in the early morning hours, can be a sign that the cartilage within the joint has worn significantly enough that bone is beginning to respond, a process called bone remodeling, which can produce a persistent, dull, difficult-to-locate ache. I also want to mention pain that has begun to radiate. If you have knee pain that has been present for some time, and you now notice that the pain seems to travel, up toward the thigh, down toward the calf, into areas that did not previously seem connected. This can indicate that surrounding tissues, nerves, bursae, tendons, and ligaments are becoming involved. Joint problems rarely stay neatly contained. They tend to spread their impact as the body compensates and other structures are asked to bear loads they were not designed for. So my question for you is this. Has the pain you experience changed in character over the past several months? Has it become less predictable, less tied to specific activities? Have you started to notice it at times when you would not expect to? At rest, at night, in the morning before you have even gotten out of bed? If so, the nature of your joint condition may be shifting, and that shift is worth bringing to your doctor's attention with specificity. The third sign is a reduction in your range of motion that you have started to work around. This is perhaps the sneakiest sign of all because it happens so gradually that most people genuinely do not notice it for a very long time. The human body is extraordinarily good at adapting. When one joint loses range of motion, other joints, muscles, and movement patterns quietly compensate, and those compensations feel so natural, so automatic, that they become invisible. Let me give you some concrete examples. If your hip has been losing flexibility, specifically the internal rotation of the hip, which is one of the first movements to go in hip joint degeneration, you may find that you have gradually been turning more with your whole body when you need to look to the side while driving. You may have stopped crossing one leg over the other without realizing it. You may find it increasingly difficult to put on a sock or shoe on a particular foot without a series of awkward maneuvers. If your knee joint is losing its full extension, its ability to straighten completely, you may have begun to walk with a very subtle bend in that knee at all times. This is called a flexion contracture, and it is extremely common and extremely under-recognized. People assume they have simply started walking differently because of pain avoidance, and that is partially true, but the loss of full extension is a structural change that, if left unaddressed, begins to place enormous additional strain on the quadriceps, the hip, the ankle, and the lower back. One joint compensated by 5 others. 5 joints quietly accumulating their own damage. If your shoulder has been losing its overhead range of motion, you may have rearranged your kitchen without consciously deciding to, placing the items you use most often at a height that does not require you to reach up. Your arm may have gradually stopped swinging as fully on one side when you walk. You may have noticed that you now sleep only on one side because the other has become uncomfortable. These workarounds are not solutions. They are your body buying time. And the price of that time is usually a broader, more complex problem than the one that started it. I want to give you a simple self-assessment you can do right now or later today. Stand in front of a full-length mirror if you have one. Look at how you are standing. Is your weight evenly distributed between both legs, or do you favor one side? Can you stand with your knees fully straight, or is there a slight bend in one of them? Slowly try to rotate your hip inward, pointing your toes slightly toward each other and feeling the rotation in the hip joint itself. And notice whether one side feels significantly stiffer or more resistant than the other. Try to bring your chin to your chest and then look up at the ceiling and notice whether that motion feels free and fluid or whether there is restriction, crunchiness, or pain in a particular direction. None of these observations alone are diagnostic, but they are data. They are the kind of information that, combined with what your doctor can assess, helps build a clearer picture of where your joints actually are right now, not where they were 2 years ago, not where you hope they are, but where they are. The fourth sign is new sounds and sensations inside your joints. The medical term for the sounds joints make is crepitus. And I want to spend a little time on this because there is a great deal of confusion about what these sounds mean, which ones matter, and which ones are largely harmless. Almost everyone over the age of 50 has experienced joint sounds to some degree. Knuckles that pop, knees that crack when you stand up, a shoulder that makes a grinding noise when you lift your arm. In many cases, these sounds are caused by gas bubbles collapsing within the joint fluid or by tendons snapping over bony prominences, and they are not inherently dangerous or indicative of damage. You have probably heard that cracking your knuckles causes arthritis. It does not. That particular myth has been studied and debunked quite thoroughly. However, and this is where the distinction matters, not all joint sounds are the same. There is a specific type of crepitus that is a meaningful warning sign, and it is the kind associated with cartilage damage. When the smooth cartilage that lines the ends of bones within a joint becomes rough, thinned, or worn through, the movement of bone against damaged cartilage produces a very particular sensation and sound. It tends to be a coarser, more grinding quality, less of a pop or a crack, and more of a persistent grating or crunching that you can feel through the joint itself, sometimes more than you can hear it. Patients often describe it as feeling like sand or gravel inside the joint. Others describe it as the sensation of two rough surfaces moving against each other, which is precisely what is happening. What I want you to pay attention to is not just whether your joints make sounds, but whether those sounds have changed. Has a knee that used to pop occasionally on the stairs started to produce a continuous grinding sensation with each step? Has a shoulder that occasionally clicked begun to feel like something is catching or grinding each time you reach across your body? Has the sound and sensation become associated with pain where it previously was not? The combination of crepitus, pain, and swelling is a triad that I take very seriously in patients. Any one of those three alone may be relatively benign. Two of them together warrant investigation. All three together in the same joint is a signal that the cartilage within that joint has likely sustained significant damage and that the window for conservative management, physical therapy, anti-inflammatory interventions, activity modification, certain injections may be narrowing. I also want to mention a specific sensation that people sometimes describe but rarely report to their doctor because they are not sure how to put it into words. It is a feeling of instability, a feeling that the joint might give way, a momentary sensation that the knee is going to buckle or that the hip is not going to hold. This is different from weakness in the muscles around the joint, though it can be related. True joint instability, the feeling that the joint itself is not secure, can occur when cartilage has worn to the point that the joint surfaces are no longer fitting together as they should, or when the supportive ligaments around the joint have been chronically overstretched by altered mechanics. If you experience this sensation, particularly in a weight-bearing joint like the knee or hip, please do not wait to mention it. This is one of the warning signs that can have safety implications. Falls, injuries, and accidents are far more common in the context of joint instability than in the context of pain alone. The fifth and final sign is a change in your activity level that you have told yourself is a personal choice. This last one is perhaps the most important of all, and it is the one that I feel most strongly about discussing because it touches on something that goes beyond the joints themselves. It touches on the stories we tell ourselves. I have had countless conversations with patients over the years that go something like this. I ask them whether they are still doing the things they used to enjoy: walking in the park, gardening, playing with grandchildren on the floor, taking trips that involve a lot of walking. And they say, "Oh, I do not really do that anymore. I am not as interested in it as I used to be." Or, "I prefer to take it easy these days." Or, "I have just slowed down a bit, which is natural at my age." And then I ask them a follow-up question. When did that change? When did the park become unappealing? When did gardening stop feeling enjoyable? When did taking it easy start to sound better than staying active? And almost invariably, when we trace it back, the change in desire corresponds almost exactly with the point at which the activity started to hurt, or to feel uncertain, or to require a level of recovery afterward that made it feel not worth the effort. The problem is that by the time someone reaches my office and tells me they have just naturally lost interest in being active, months or sometimes years have already passed, during which their joints have been deteriorating, their muscles have been weakening, because muscle weakness accelerates joint degeneration significantly, and their world has quietly been getting smaller. The avoidance of movement is both a symptom of joint disease and a cause of its acceleration. This is one of the most frustrating cycles in all of musculoskeletal medicine. Movement, even imperfect movement, even movement that involves some discomfort, is in most cases essential to joint health. Cartilage does not have a direct blood supply. It receives its nutrition through the compression and release of movement, through the circulation of synovial fluid that is driven by activity. When we stop moving, cartilage receives less nutrition. Muscles that support and protect the joint weaken. The joint becomes less stable, the load distribution across the joint surface becomes less even, and the damage accelerates. I am not telling you to push through severe pain. I am not suggesting that you ignore your body's signals. What I am asking you to do is look honestly at whether the activities you have stopped doing, the things you have told yourself you have simply lost interest in, might actually be activities that your joints have made feel too costly. Because if that is the case, that is not a lifestyle preference. That is a warning sign. Ask yourself honestly, what did you do 2 years ago that you do not do today? What do you avoid without consciously deciding to avoid it? What has your world gradually stopped including? If the answer involves movement, physical activity, or any form of engagement with the physical world around you, I want that to be a conversation you have with a doctor who understands joint health. Because very often, the trajectory that feels irreversible is not irreversible, but the window does not stay open indefinitely. Now, I want to bring all 5 of these signs together because in my experience, it is rarely just one of them in isolation. Joint disease tends to be a story told across multiple chapters simultaneously. Morning stiffness that has been gradually lasting longer tells you that inflammation inside the joint is not resolving as efficiently as it should. A change in the quality of pain from predictable activity-related discomfort to more constant rest-related, sometimes nocturnal aching tells you that the inflammatory process has become more active and less contained. A reduction in range of motion that you have been working around tells you that structural changes within the joint, thickening of the joint capsule, loss of cartilage height, bone remodeling at the joint margins, have been accumulating long enough to alter the mechanics of how you move. New grinding, catching, or instability sensations tell you that the surfaces inside the joint have changed in ways that are affecting function, and a quiet retreat from activity, reframed as preference, tells you that the cumulative impact of all of the above has been significant enough to reshape your daily life. If you are recognizing yourself in 2 or more of these signs, I want to be very direct with you. This is the right time to seek evaluation, not because things are necessarily at a crisis point, often they are not, but because the interventions that are available earlier in this process are meaningfully better than the ones available later. Physical therapy initiated early can slow progression significantly, rebuild protective muscle mass, and restore range of motion. Nutritional interventions addressing deficiencies in vitamin D, magnesium, and omega-3 fatty acids, all of which play roles in joint health and inflammation, are most effective when the underlying joint is still reasonably intact. Certain injectable treatments and newer regenerative approaches have substantially better outcomes earlier in the disease process. And the habits that protect joints, appropriate low-impact exercise, weight management, sleep quality, stress reduction, all of which influence inflammatory markers in the body, are habits that take time to establish and that benefit you most when started before the damage is severe. I want to close with something that I tell every patient I see who is worried about where their joint health is heading. The fact that you are paying attention, the fact that you are watching this video, asking these questions, noticing these signs, that is not cause for despair. That is cause for action. The body gives us signals for a reason. The morning stiffness, the changing pain, the quiet loss of range of motion, the sounds your joints are making, the activities you have been avoiding, all of these are your body asking for help. And the best time to answer that call is right now. If anything in this video has resonated with you today, I want to encourage you to do 3 things. First, write down which of these 5 signs you recognize in yourself and how long you have been experiencing them. Be specific. Dates, durations, affected joints, associated activities. Second, share that written account with your doctor at your next appointment, or make an appointment specifically to discuss it if you have been putting that off. And third, in the meantime, do not stop moving. Keep walking, keep stretching, keep your joints as mobile as your current level of comfort allows. Movement is medicine. Imperfect movement is still medicine. Thank you so much for spending this time with me today on Mobility Matters. If this video has been helpful, please share it with someone you know who might be experiencing any of these signs. A parent, a spouse, a friend, someone who has mentioned that their knees are not what they used to be, or that they have had to slow down. Sometimes all it takes is someone putting words to something that a person has been quietly living with for a long time. And if you have questions, or if there are topics related to joint health and mobility that you would like me to cover in future videos, please leave them in the comments below. I read every single one. Until next time, keep moving, keep paying attention, and take good care of yourselves.